Hi friends, good evening. This is Dr. Chetna Jain. Once again, we are here to discuss some topic of our interest. So currently, after the 1st May, when the government has opened vaccination for people of all ages, I have been getting a lot of queries practically every day by all those women who are pregnant or who's lactating. A lot of them I have delivered already. Some of them are acquaintances and friends, and others are friends of the patients I have delivered. So each one has the same question whether they can receive the vaccination during pregnancy, during menstruation, during lactation, what if they are planning to conceive, what if they are on anti anxiety medicines, if they are taking medicines for hypertension, if they are diabetic, they have other disorders, they had COVID in the past, and so on. So today I'm going to talk on the topics. Meanwhile, if you have questions regarding this, you can certainly text us or put it in the box, and I can take your questions towards the end of the presentation. So I'm Dr. Chetna Jain. I work at Dr. Chetna's clinic in Kuala Bihar, and also I'm director and head at the Cloud9 Hospital Sector 14. So today we are talking on whether vaccination can be done during pregnancy, lactation, and for women of all ages and at what times. COVID vaccine, as you know, corona is a very serious disease, and now that we are facing the second wave, the problem is the morbidity, that means the spread rate is very high, and the mortality, that means the death rate is also very high. In the first wave, we saw mostly the deaths were occurring on the television, in the newspaper, but we hardly knew anyone who was dying in person. But this time, each one of us has a story to tell. Each one of us has a family or friend who has died. We know all these people directly and indirectly, and we have all faced deaths. And the worst part is we can't go and meet those people, we can't hug them, we can't kiss them, we can't hold them, we can't grieve with them. You can just send some virtual messages, and that is the end of the day. There is no rasam bagdi, there is no grieving, there is nothing. We are just sitting in our own cocoons as if nothing matters more than our lives, which is a fact. So, here we are to discuss whether COVID vaccination, what is the benefit, whether it's going to protect us or not, and what all. So, as you understand, there are a variety of COVID vaccines available in India. The front runners are Covaxin and Covidshield. They each have their own pluses and minuses. So, here we are not discussing the choice of vaccine. The second thing is probably choice of vaccine is not available, and we must take whatever is offered at this point, because as we understand there's a shortage of dosage, and you all know about Adar Poonawalla and other stories. So I'm not going into that. Here we are. So let's talk about who all can take vaccines. Number one, anyone who is fit and fine and of the age over 18 can take vaccine. Now, what is the best time to take vaccine? Now, the timing to take vaccine is once you take your first dose. The second dose, if it is taken between 8 and 12 weeks, is more beneficial compared to when it is taken at 4 weeks, but you need a minimum interval of 4 weeks. The third question is, if you have taken Covaxin and next time, can you take Covishield? The answer is no. Whatever vaccine you take, the first dose, the second dose has to be completed by the same vaccine. The other question is, if you have taken one course of suppose Covaxin, whether after a couple of months you should be taking another kind of vaccine like Covishield or Moderna, Pfizer or Sputnik, or there are many more. So the answer is no. As of now, there is no recommendation that once you have completed one course of vaccine, you should be taking the newer vaccines, the other group of vaccines. Now, what is the protection rate of the vaccine, and can vaccine prevent the disease? Absolutely. So, the protection rate of vaccine is about 70 to 80%. It cannot guarantee a completely immunity against the coronavirus, but there is a possibility that the immunity will work for you. And if it doesn't work, the kind of disease which will happen is likely to be mild. Still, it is extremely important to keep on wearing the double mask, wash your hands regularly, and ensure distance from other people, and that is the only way you can prevent it, because coronavirus is not anymore droplet borne. It is now considered airborne. That means even if you are away from the people, it can actually fly and come to you, and unless you protect yourself, your eyes, nose and ears very properly, there is a likelihood of virus entering the body. Now, so the next question would be, can women in pregnancy take coronavirus vaccine? Now, the thing is, coronavirus vaccine, most of them are killed vaccines. They are not live vaccines, they are not live attenuated vaccines, they are killed vaccines. So, these vaccines are unlikely to cause any kind of problem. A lot of women are given, I guess more than 50,000 women are already, who are pregnant, are already given this vaccine, and no side effect has been noted so far. Most of the international bodies like FIGO, that is the Federation of International Gynecologists, FOXI, that is the Indian Body of Obstetricians and Gynecologists, CDC, that is Center of Disease Control, and WHO. So these are very renowned world bodies, and they have all agreed that vaccine is safe to be given during pregnancy. Then why? What is the hitch? The hitch is still the vaccine is not licensed by the government of India, by the Ministry of Health, to be given to the pregnant women. Now, in this light, what pregnant women can do? Since we understand that most of the international bodies and the professional bodies believe that this vaccine is absolutely safe in pregnancy, you must read up more, you must talk to your physician, and in case you want to take the vaccine, you sign a consent that you understand that this is the current status, and after that, you decide whether you want to take the vaccine or not. Now, when it comes to breastfeeding, the status remains the same, that you can take vaccine, there is no problem. It is likely to produce antibodies in your body and will protect you against COVID virus. Because the COVID virus, once it occurs, 85% people will not have any problem, but 15% people could be very sick and need hospitalization. And to reduce the number of hospitalization, so we have seen that herd immunity is not working, and to reduce the hospitalization, if we make our own antibodies by taking the vaccine, it is safe. Now, what happens once you take the vaccine? A lot of women would complain of uneasiness, uh, pain at the injection site, itching at the injection site, uh, 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 body ache, and fever. But majority of these symptoms will last. Hello. Sorry, there was a loss of connection. So majority of these symptoms will last for a couple of days and then they will wane off. But the protection they will offer will be immense. So it is recommended that all pregnant and lactating women that take their vaccine as and when their turn comes. But if and there is no problem if you are menstruating, because menstruation is doesn't get affected, so you need not worry that your appointment of vaccination will come on a day when you are menstruating or you are about to menstruate or so on. So feel free to take the vaccine. If you're planning a baby, that is also not a concern. If you're planning, you continue planning, and meanwhile, if you take the vaccine and you get pregnant, you can still complete your dose without getting worried about the effect of vaccine on the pregnancy. Similarly, the vaccine doesn't get secreted into the, it's unlikely to be secreted into the breast milk and affect the fetus. So whatever we know, the current status is all of you can take the vaccine, even if you're pregnant, if you're lactating, if you are having menstruation, if you're taking anti-anxiety medicines, if you're taking some other kinds of medicines. But if you have suffered coronavirus in the last, the COVID disease in the last 4 weeks, you should be waiting till the disease completely settles and then wait for 4 weeks and then take your vaccine. So it's not right to take the vaccine when you're already infected. Now, there's a possibility of some antibodies remaining behind once you've had coronavirus disease. but that immunity typically wanes off in 1 to 2 months, and again, then you will become prone to infection. That means it doesn't give you a long immunity, unlike the other viruses. And in this scenario, vaccination is likely to give more immunity. Not everybody is developing antibodies with vaccine, but majority of the people would develop, and once they have the vaccine, they have less likelihood of catching the disease, they have less likelihood of catching the severe disease, they have less likelihood of hospitalization, and they have less chances of dying. And we all understand the deaths have become very commonplace because of the COVID disease, and it is extremely important to protect all of us. So my humble request is, in case you get a chance, and even if you're pregnant, you are lactating, you are having menstruation, you are having anti-anxiety or some other kinds of medication, unless it is absolutely contraindicated, like you, if it is suggested by a doctor that you're having some severe organ disease or severe diabetes, and your physician is telling no. So these are the only contraindications when you should not be taking the vaccine. If you're already suffering or you're a recent sufferer of COVID disease, then obviously you will not be taking the vaccine. The rest of you can take the vaccine very safely and hopefully very effectively. Stay safe, stay home, stay away, wash your hands, wear double mask, keep talking to your doctor, and please relieve your anxiety. I see a lot of my patients very anxious these days. Please, once you are home, it's very unlikely that you catch the disease. Still, you continue meditation, deep breathing. Mental health is equally important. You understand that there's a lot of lockdown and you're all trapped at home, but still, it is important to maintain the mental cool, stay happy, stay safe, keep in a situation of bliss. Believe that this is God's chance which is given you for rejuvenation. So please utilize your time well. Do not feel bad about the lockdown. Again, we are going to go to happy times, but these are the times when we must stay calm, quiet, relaxed, and believe that this shall also pass. Thank you so much. If you have any questions, I'm willing to take now. So, what are the precautions for breastfeeding for a COVID-19 positive mother? Yeah, this is a very relevant question. So, the thing is, if the woman is not very sick, that means if she's asymptomatic or she's having very mild symptoms. So, in this scenario, these women can actually wash their hands well, wear washed clothes, wear a double mask, and probably feed their child. But the rest, but if they are very sick, they're not able to breathe well, and the situation is not so good. In that scenario, still they can wear the double mask, wash their hands, express the milk, and give it to the baby. If they are not in a position to send the milk to the baby and they are hospitalized, still they should be taking out their milk and removing the milk from the breast every 4 hours till the time they reach home. Because if they don't do that, the possibilities are two, that they might get breast engorgement, or they might have complete absence of lactation or a markedly reduced lactation once they reach home. So the precautions are, you try not to kiss your baby, you try to be, keep the baby on your side when you're not feeding, don't play. But when you have to feed the baby, you wear double mask and feed your baby. Can I breastfeed after COVID vaccine? Yes, certainly you can breastfeed after COVID vaccine. There is no time interval which is suggested that, if you've taken the vaccine after 4 hours or 6 hours or nothing of that sort. You can take the vaccine and come home and feed the baby without any fear. If I got COVID positive during pregnancy, is there any possibility that my child can also be affected? So as of now, there's a very small possibility of the child getting infection in the uterus. Probably 1 or 2 cases reported world over and not more. But yes, of late we are seeing more newborns who are COVID positive, and the treatment is done accordingly. But since the newborns have less likelihood of developing cytokine storm and inflammation, their recovery is better. So as of now, you should not be worrying about getting COVID that transmitting COVID to the fetus. And I hope that you don't get COVID. You take your vaccine. Thank you. Thank you.